So today I would like to demonstrate for you how you will check a prescription, and this lends itself to our assignment for the independent double check. So what is displayed here is a prescription that has been presented from a patient. We have collected the information that we need. So the patient's name, address, their birth date. It indicates that there's no known allergies for the patient. We've got the phone number. I'm assessing this prescription to make sure that I can read it appropriately. I can see the doctor's name very clearly. The refills are depicted here as well. The prescription was written today. So I'm doing that kind of quick assessment upon intake to make sure that everything is legible on this prescription for me. So then once this gets processed through our computer, we end up with this printout that comes from our computer system. So I generated this through my community pharmacy. I've had some issues with my printer and ink and so on and so forth. So this is what it looks like. It's a full printed out sheet, and there's some components on here that we'll talk about today. So we have the two prescription labels up at the top. We have a delivery label, and then the component that we use primarily for when we're checking a prescription is this area here, and this is our hard copy. So once this would get generated through our computer system, comes off of our printer, then we take both of these pieces of information. The medication gets selected from the shelf. So we have Pantaloc. Sorry, I just want that to focus a little bit better for you. So we have Pantaloc 40 milligrams. So then the first thing that I'm doing when I'm actually preparing this, I'm making sure first and foremost that the DIN number that I've selected from the shelf in fact matches what has been dispensed through the computer. So then I'm underlining, I'm initialing that DIN number, and then I'm going to go ahead and count this medication. So I'm just going to slide this out of the way for a second. So here's my counting tray. Folding, or the gate to open and close, this captures our medication for us. So on this prescription, what's been dispensed is we've dispensed 30 tablets, so I'm going to count 30 of those tablets, and we count by fives. And we count by fives because that's the kind of the easiest number to visually see when we're doing our counting. So now I've got what I need to provide to the patient. I'm going to close this door, and then I have one more tablet that doesn't go to the patient. So that's going to go back into the stock bottle. And then I have my medication vial. Open the lid, and now I pick this up and I put it into the vial for the patient. So now this can go away. Close the lid. And now I have one of these two labels to select to place on the medication vial. Doesn't matter which one you pick. I like to turn it away from the safety closure, not for any particular reason. That's just the process that I follow. I put it on the back, make sure it's lined up straight, it's not crooked. Good, so that now that is labeled. There's some additional auxiliary labels that we would need, so we would want to reference our auxiliary chart to determine what auxiliary labels we need to place on this product. Sorry, I'm digging in my box here. don't have the necessary auxiliary label. But when we look at this particular product here, it does indicate to us that it is, sorry, I'm getting a bit of a glare. It is an enteric coated product, so we would want to place the do not chew but to swallow whole auxiliary label on this product as well. Okay, so I will move that just slightly out of the way. So now it has been prepared. You'll see my initials here. Ideally what would happen is I would prepare this and then someone else would come along and check it. It's not best practice to be checking your own work. Even better yet, I would have an assistant and I would see that assistant's initials beside mine, so then I could identify who was the person that processed it through the computer and who is the person who actually checked it. We also identify that information down below as well. It's a little bit hard to see, I think. So down at the bottom in this grayed out area, it says check of entry, RX fill. So that typically means who processed it through the computer. Order entry, and then that final check. So in this particular situation, I would have done all of these things. So I would have filled the prescription. I did the order entry because my initials appear here at the top. And then I'm going to do this final check as well. I shouldn't be signing this just yet until I actually go through the process of doing the final check, which I'm going to do now. So in this checking, what I'm doing is I'm working my way essentially from the top of the hard copy, and I'm working my way down and comparing it to the prescription itself. So the first thing I'm doing is, first and foremost, I'm confirming that the patient matches who it's supposed to be for. So I can see the prescription is for Suzette Lewis, and that's actually the hard copy that I have in front of me. So I'm placing a check mark beside that. And then again, I'm just working my way down all of these to make sure that everything matches. The address matches, 12 Drake Close, the person lives in Red Deer, their healthcare number, which doesn't appear on here, but if you were to receive a computer-generated prescription from the physician, it would likely indicate the person's personal healthcare or Netcare number as well. And so I'm just working through this header component here first. Again, this is the information that's in the patient's profile, so I'm confirming all of this before I move further down. So date of birth, so August 30th, 72, that matches. Now you all know where I live and how old I am. Then the phone number also matches what's been placed here. And now I'm going to work through checking the drug information. So here again, as the final check person, then I'm confirming that I do in fact have Pantelop 40 milligrams. I like to circle that just to confirm that I've checked that drug strength. That matches what is on the prescription. It should be the 40 milligrams. The intention was to dispense 30. That is correct based on the METE for the patient. So this is saying take 1 tablet once a day. So I've got the right drug. The day's supply is correct. Now this says OTC RX, and that's just because I did this in my actual pharmacy. So I didn't want to be utilizing an actual physician, even though I was canceling this. But for demonstration purposes, it says OTC as the doctor, but realistically it should indicate this physician's name here. So we're going to say that's correct. And then from there, now I'm making sure that the SIG is correct. So again, everything that you see on this hard copy is going to mirror everything that's on this label. And this is what is obviously placed on the patient's medication. So now I'm confirming that the information, the instructions to the patient, so it says 1 QD, so my instructions match. There's no distinction between the original and the TX number. If I had made some changes or done something, maybe I forgot the refills or I had to change something in the SIG, then these numbers might differ a little bit. It's just a transaction number. It identifies anything that we do with this particular prescription. So it will track all transactions and identify a different number if we've made any changes. So that's why you might see a difference in these two numbers. And you won't see that until you get actually practicing in the lab. So take 1 tablet daily, that matches. I'm confirming the authorized quantity. So the authorized quantity is today's 30 plus the 6 for a total of, did I get it right? So we have the 30 plus 6 times 30. So 6 times 30 is 180 plus the 30 gives me this 210. So that is correct. You wouldn't necessarily do this math on the front, but if you needed to, just to confirm the refills were correct, then that is perfectly fine to do so. So the remaining is 6 because we've sent the patient off with 30 and they have these 6 refills that are remaining. So the refills are correct. I'm also then taking a quick look to make sure that the cost has come through. I don't necessarily know the cost for certain, but I need to see a number here. I need to see that there's a markup that's been charged. I need to see that my fee has happened as well and that there's a total price here. This didn't go through any third-party plan, so it's just saying third party is 0 and then Netcare paper copy is 0 as well. This will get used at different levels in practice depending on what your pharmacists are up to. So whether they counseled or they didn't counsel, and whether they did that in person or via phone, so on and so forth. So that's my checking procedure for making sure that the right product has been dispensed. So this would be considered a final check. And again, I should have only signed this at the moment when I've done the final check, not before. You don't pre-sign anything. You only check it at its actual completion. And then in addition to that, I am doing a quick bit of a glance just to see what the patients had filled in the past. So there's a couple of other medications listed here, metformin, Pantaloc, just kind of a quick glance, nothing too labor intensive. And then confirming that the receipt appears appropriate based on the appearance of third-party information or not. So because there's no third party involved, I should see a receipt that has the total amount. Now I'm not making any marks on this component because this piece right here, this all gets detached. Oh, here's a label. Look, I can take this label and I can put it on here. And now I've solved that because that's also what I'm checking to make sure is that the product was labeled appropriately. It is our responsibility to make sure it's labeled correctly. So thankfully I have this label to include with it. And outside of confirming the documentation, making sure that the paperwork, the prescription matches what was dispensed through the computer. Additionally, I'm making sure that what is inside this vial matches what there should be. So you do get better with identifying products and knowing what they look like, but that's part of the final check process also, is making sure that what we intend to be in that vial is in fact in that vial. Okay, so that is how I do a final check of a prescription. So really starting at the top of both documents and working my way down. Now you'll want to find your own process, what you're comfortable with, but just to kind of give you a basic guideline of what I do, that's my demonstration for that.